Hello everyone, today we're going to talk about autism spectrum disorder. Autism spectrum disorder is a condition related to brain development that impacts how a person perceives and socializes with others. This causes problems in social interactions and communication. The disorder also includes limited and repetitive pattern of behavior. Spectrum refers to the wide range of symptoms and severity. The disorder includes conditions that were previously considered separate, such as autism. It wasn't called autism spectrum disorder. There were separate diseases, including autism, which refers to a broad range of conditions characterized by challenges with social skills, repetitive behavior, speech, and nonverbal communication. So basically, it is an abbreviation for autism spectrum disorder. There's also Asperger's syndrome, which is a neurodevelopment disorder characterized by significant difficulties in social interaction and nonverbal communication, along with restricted and repetitive patterns of behavior and interest. There's also childhood disintegrative disorder, or CDD. It is a rare disorder characterized by a late onset of development delays or severe and sudden reversals in language, social function, and motor skills. And the last condition is an unspecified form of pervasive developmental disorder. Autism spectrum disorder begins in early childhood and eventually causes problems in functioning in society, socially, in school, and at work. For example, children show symptoms of autism within the first year, and then go through a period of regression between 18 and 24 months of age when they develop autism symptoms. There is no cure for autism spectrum disorder, but early treatment can make a big difference in the lives of many children. Symptoms show up in infancy, such as reduced eye contact, lack of response to their name, or indifference to caregivers. Some children may develop symptoms normally for the first few months or years of life, but then suddenly become withdrawn or aggressive or lose language skills they've already acquired. Signs are seen by the age of 2. Each child with autism spectrum disorder is likely to have a unique pattern of behavior and level of severity, from low functioning to high functioning. Some children with autism spectrum disorder have difficulty learning, and some have signs of lower than normal intelligence. Other children with the disorder have normal to high intelligence. They learn quickly, but they do have trouble communicating and applying what they know in everyday life. Because of the unique mixture of symptoms in each child, severity can sometimes be difficult to determine. It's generally based on the level of impairment and how they impact the ability to function. On the next slide, there are some common signs shown by people who have autism spectrum disorder. Social communications and interaction. A patient with autism spectrum disorder may have problems with social interaction and communication skills, including fails to respond to his or her name, or appears not to hear you at times, resists cuddling and holding, and seems to prefer playing alone, retreating into his or her own world, has a poor eye contact and lacks facial expression, doesn't speak or has delayed speech or losses previous ability to say words or sentences, can't start a conversation or keep one going, or only starts one to make requests or label items. Speaks with an abnormal tone or rhythm and may use a sing-song voice or robot-like speech, repeats words or phrases verbatim but doesn't understand how to use them, doesn't appear to understand simple questions or directions, doesn't express emotions or feelings and appears unaware of others' feelings, doesn't point at or bring objects to share interest, inappropriately approaches a social interaction by passive, aggressive, disruptive, has difficulty recognizing nonverbal cues, such as interpreting other people's facial expressions, body postures, or tone of voice. There's also patterns and behaviors. A pattern with autism spectrum disorder may have limited, repetitive patterns of behavior interests or activities, including performs repetitive movements such as rocking, spinning, or hand flopping, performs activities that could cause self-harm, such as biting or headbanging, develops specific routines or rituals, and become disrupted at the slightest change, has problems with coordination, or has odd movement patterns such as clumsiness or walking on toes, and has odd, stiff, or exaggerated body language, is fascinated by details of an object such as the spinning wheels of a toy car, but doesn't understand the overall purpose or function of the object, is usually sensitive to light, sound, or touch, yet may be indifferent to pain or temperature, doesn't engage in imitative or make-believe play, fixates on an object or activity with abnormal intensity or focus, has specific food preferences such as eating only a few foods or refusing foods with a certain texture. As people become mature, they eventually lose the symptoms of autism spectrum disorder. They become more engaged with others and show fewer disturbances in behavior. Some people live the normal life or near normal lives, but some people continue to have difficulties with language or social skills, and the teen years can bring worse behavioral and emotional problems. Some people with autism spectrum disorder show symptoms before the age of 2. If you suspect that you have autism spectrum disorder, discuss your concerns with the doctor. The symptoms can also be linked with other developmental disorders.
I have a
Your
question.
ask why.
I'm sorry to interrupt, but like, um, can it happen in like any stage in your life? Like, not very early stage, but like maybe when you are in the 20s or something like that, or it only happens since you are born, or
No, it
like.
decreases. It decreases as you become older, but it usually happens at teenage.
Oh yeah, okay, I got it.
So it's developed, not inherited.
It is inherited, and sometimes it is developed.
Oh, I see.
Any other questions?
I have just to add a comment on that. You can't develop autism after 3 years of age. So parents have to see the symptoms and before the age of 3 to know if a child has autism. They're gonna see them because he's gonna act weird.
Yeah, I
Uh,
never heard of anyone developing autism in their teenager, but I might be wrong, I guess.
it happens before the age of 2. The symptoms show up. Okay, your doctor may recommend developmental tests to identify whether you have autism spectrum disorder or not. If you doesn't respond with a smile or happy expression by 6 months, doesn't mimic sounds or facial expressions by 9 months, doesn't babble or coo by 12 months, doesn't gesture such as point or wave by 14 months, doesn't say single words by 16 months, doesn't say two-word phrases by 24 months, loses language skills or social skills at any age.
There's also mild autism that cannot even be noticed sometimes.
Yeah, there is. Autism spectrum disorder has no single known cause. There are probably many causes. Both genetics and environmental may play a role. Genetics, several genes appear to have a role for autism spectrum disorder. In children, autism spectrum disorder may be associated with genetic disorders such as Rett syndrome, which is a rare genetic neurological disorder that leads to a severe impairment and happens exclusively in girls and rarely in boys. And there's also Fragile X syndrome, which is a genetic disorder characterized by mild to moderate intellectual disability. For other children, Genetic changes may increase the risk of autism spectrum disorder. Some genetic mutations seem to be inherited, while others occur spontaneously. Environmental factor. Some factors, including viral infections, medications, or complications during pregnancy, or air pollutants, play a role in triggering autism spectrum disorder. There is a theory that autism spectrum disorder is linked with childhood vaccines, but there is no reliable link between autism spectrum disorder and any vaccines. Avoiding childhood vaccinations can place your child and others in danger of catching and spreading serious diseases, including whooping cough or pertussis, which is a highly contagious respiratory tract infection, measles, which is also a highly contagious illness caused by a virus that replicates in the nose and throat, or mumps, which is a viral infection that primarily affects saliva-producing glands that are located near your ears. The number of children diagnosed with autism spectrum disorder is rising. It's not clear whether this is due to better detection and reporting or a real increase in the number of cases, or both. Autism spectrum disorder affects children of all races and nationalities, but certain factors increase a child's risk and may include gender. Boys are about 4 times more likely to develop autism spectrum disorder, and family history. Family history of someone with autism spectrum disorder may cause an increased risk of you having autism spectrum disorder. Okay, so we talked about gender and family history. There's also other disorders. People with certain health conditions have a higher than normal risk of having autism spectrum disorder or autism-like symptoms, such as Fragile X syndrome, tuberous sclerosis, which is a condition in which benign tumors develop in the brain, and Rett syndrome. Extremely preterm babies. Babies born before 26 weeks of gestation may have a greater risk of autism spectrum disorder. And parents' ages. There may be a connection between children born to older parents and autism spectrum disorder, but more research is necessary to establish this link. Autism spectrum disorder can lead to problems in school and with successful learning, employment problems, inability to live independently, social isolation, stress within the family, victimization, and being bullied. There is no way to prevent autism spectrum disorder, but there are treatment options. Early diagnosis and intervention is most helpful and can improve behavior, skills, and language development. Intervention is helpful at any age. Children usually don't outgrow autism spectrum disorder symptoms. They may learn to function well. If you have any symptoms of autism spectrum disorder, it's likely to be referred to a specialist, child psychiatrist or psychologist, pediatric neurologist, or developmental pediatricians can evaluate and help you with your autism spectrum disorder. They will check for signs of developmental delays at regular checkups. Making a diagnosis may be difficult because autism spectrum disorder varies widely in symptoms. A specialist may observe and ask how your social interactions, communication skills, and behavior have developed and changed over time. Give tests covering hearing, speech, language, developmental level, and social and behavioral issues. Present structured social and communication interactions to you and score the performance. Use the DSM-5 criteria published by the American Psychiatric Association. Include other specialists in determining a diagnosis, and recommend genetic testing to identify whether your child has a genetic disorder such as Rett syndrome, Fragile X syndrome. As we said, there is no cure exists for autism spectrum disorder, but early treatments is more functioning. If your child is diagnosed with autism spectrum disorder, talk to experts about creating a treatment strategy and build a team of professionals to meet your child's needs. There's behavior and communication therapy, uh, which will many programs address a range of social, language, and behavioral difficulties associated with autism spectrum disorder. Some programs focus on reducing problem behaviors and teaching new skills. Other programs focus on teaching children how to act in social situations or communicate better with others. Applied behavior analysis can help children learn new skills and generalize these skills to multiple situations through a reward-based motivation system. Educational therapies. Children with autism spectrum disorder often respond well to highly structured educational programs. Successful programs typically include a team specialist and a variety of activities to improve social skills, communication, and behavior. Preschool children who receive intensive individualized behavioral interventions often show good progress. There is also family therapies. Parents and other family members need to learn how to play and interact with children who have autism spectrum disorder, teaching daily living skills and communication, and other therapies. Depending on your child's needs, speech therapy to improve communication skills, occupational therapy to teach activities of daily living, and physical therapy to improve movement and balance may be beneficial. A psychologist can recommend ways to address problem behavior. And there's also medications. No medication can improve the core signs of autism spectrum disorder, but there are specific medications that can help and control symptoms. For example, certain medication may be prescribed if your child is hyperactive. Antipsychotic drugs are sometimes used to treat severe behavioral problems, and antidepressants also may be prescribed for anxiety. Managing other medical and mental health conditions. Children, teens, and adults can also experience medical health issues. Children with autism spectrum disorder may also have medical issues such as epilepsy, sleep disorders, limited food preferences, or stomach problems. You need to ask your doctor how to best manage these conditions together. It also has problems with transition to adulthood. Teens and young adults with autism spectrum disorder may have difficulty understanding body changes. Also, social situations become increasingly complex in adolescence, and there may be less tolerance for individual difference. Behavior problems may be challenging during the teen years. Other mental health disorders. Teens and adults with autism spectrum disorder may often develop other mental health disorders. Planning for the future. Children with autism spectrum disorder typically continue to learn and compensate for problems throughout life, but most will continue to require some level of support. Planning for your child's future opportunities such as employment, college, living situations, independence, and the service required for support can make this process smoother. You can use also alternative medicines such as herbs, but you must require permission from the doctor to use them. Also, alternative medicine including creative therapies. Some parents choose to supplement educational and medical intervention with art therapy or music therapy, which focus on reducing a child's sensitivity to touch or sound. These therapies may offer some benefit when used along with other treatments. Sensory-based therapies. These therapies are based on the unproven theory that people with autism spectrum disorder have a sensory processing disorder that causes problems tolerating or processing sensory information, such as touch, balance, and hearing. Therapists use brushes, squeeze toys, trampolines, and other materials to stimulate these senses. Massage. Massage may be relaxing. There isn't enough evidence to determine if it improves symptoms of autism spectrum disorder or not. Pet or horse therapy. Pets can provide companionship and recreation, but more research is needed to determine whether interaction with animals improves symptoms of autism spectrum disorder. You need also to fix your diets. Restrictive diets can lead to nutritional deficiencies. If you decide to pursue a restrictive diet, work with a registered dietitian to create an appropriate meal plan for your child. You need also to increase your vitamin by getting vitamin supplements or eating good fruits. Although not harmful when used in normal amounts, there is no evidence they are beneficial for autism spectrum disorder symptoms, and supplements can be expensive. Talk to your doctor about vitamins and other supplements and the appropriate dosage for your child. Acupuncture. This therapy has been used with the goal of improving autism spectrum disorder symptoms, but the effectiveness of acupuncture is not supported by research. Chelation therapy. This treatment is said to remove mercury and other heavy metals from the body, but there is no known link with autism spectrum disorder. Chelation therapy for autism spectrum disorder is not supported by research. In some cases, children treated with chelation therapy have died. Hyperbaric oxygen treatments. It's a treatment that involves breathing oxygen inside a pressurized chamber. This treatment has not been shown to be effective for treating autism spectrum disorder symptoms, and it is not approved by Food and Drug Administration, FDA. Intravenous immunoglobulin infusions. Also, there is no evidence for improving autism spectrum disorder, and the FDA has not approved it. Copy and support. Find a team of trusted professionals. A team coordinated by your doctor may include social workers, teachers, therapists, and a case manager or service coordinator. These professionals can help identify and evaluate the resources in your area and explain financial service and states and federal programs for children and adults with disabilities. Keep records of visits with service providers. You need to always record your visits with service providers. Your child may have visits, evaluations, and meetings with many people involved in his or her care. Keep an organized file of these meetings and reports to help you decide about treatment options and monitor progress. Learn about the disorder. If you learn about the disorder, you're likely to remove it and treat it helpfully. Take time for yourself and other family members. Caring for a child with autism spectrum disorder can put stress on your personal relationships and your family. To avoid burnout, take time to relax, exercise, and enjoy your favorite activities. Try to schedule one-on-one time with your other children or other friends, and plan date nights with your spouse or partner, even if it's just watching a movie together after the children go to bed. Seek out other families of children with autism spectrum disorder. Other families struggling with the challenges of autism spectrum disorder may have useful advice. Ask your doctor about new technologies and therapies. See the Centers for Disease Control and Prevention website on autism spectrum disorder for helpful materials and links to resources. And here is the end of the presentation. Thank you for your attention.